provide patient privacy. Good evening, my name is Santana. I am here to do a wound dressing change on you. Before I start that, will you please give me your first name, your date of birth? It's Ellie Field, 8/19 of 63. Okay, perfect. Ellie, can you tell me if you are in any pain right now? My patient right now is not in any pain. If she were to be prescribed a pain medication, PRN, I would administer that at least 45 minutes prior to doing this dressing change. I am going to perform hand hygiene. Here is where I would don on my mask. I would don on my PPE, my gown, and then my gloves. I have my equipment ready right here. Miss Ellie, I see that you are already on your right side. Are you comfortable like that? I would like to get a hold of that, to get that dressing removed on that left leg. Okay, you're comfortable like that? Okay, I'm gonna go ahead and move your blanket. Grab my equipment. I'm gonna place this chuck right underneath you, okay? Are you comfortable like that, Mrs. Ellie? Okay. This would be on her left leg. I would make sure my patient is warm, comfortable. I'd make sure I have her bed rail up so she can have something to hold on to. Now I have her leg exposed. I'm gonna go ahead and, this is my biohazard bag. I'm gonna go ahead and open that. And this bag, I would like to have it placed right next to her leg. That way it's easy to just throw her stuff away. Before I do that, I'm going to set up here. I'm going to go ahead and open this. There, and I'm going to uncover this. This is my pre-filled syringe for my irrigation. Okay, now I'm going to go ahead and remove the dressing. That I would go ahead and hold the skin taut. During this whole time, I would have the bed at a good level to where I can work comfortably and I don't strain my back. Okay. Mrs. Ellie, are you doing okay? Okay. As the dressing comes off, I will be assessing the wound. I would also be assessing the drainage for blood, pus, any slough, the smell, if there is any smell whatsoever, which I don't see. I'm going to remove any extra stuffing that has been in there. Whoop, whoop. Sorry, this did not happen. So now that I have the wound dressing off, I'm going to go ahead and take off these gloves. And I would perform hand hygiene. And now I'm going to apply my sterile gloves on. Here, where I would open, grab this, throw that away. sorry, with all the practice, I'm trying to, this would normally not happen, but I'm gonna go ahead and fix it. So I would finish here and make sure this is not touched with my left hand. And now I'm gonna go ahead and again, same reason. Make sure that. And now I'm gonna go ahead and grab my kit, open it, weigh. Here, I would grab my ruler and I would measure the wound. I would measure the length and the width. If I remember correctly, I'm not supposed to touch my gloves and the ruler on here. And then I would throw that away. And now I would remove these gloves and I would put on another set of sterile gloves. So I am sterile again. Now being sterile, I'm gonna go ahead and open up my drape. I'm gonna put my tape here, my gauze here. I would take my normal saline out and cap it. And then pour that in. Okay. Now I would grab my syringe. When I irrigate a wound, I want to irrigate from the top so the solution flows down. So I would irrigate, and so that way it would flow down, and I would irrigate with the pre-filled syringe until I don't see any more exudate, any more pus. Then I would toss that. With my clean gauze, I would go ahead and take off any extra with clean gauze. This is my clean, my contaminated hand. So now with my clean hand, I would stuff the gauze, make sure it is not fully soiled with normal saline. Okay. And then I would place that in there. Okay. And then now I would open this and cover my wound. I would take off my sterile gloves. Perform hand hygiene. And then I would apply clean gloves on. Mrs. Alley, are you doing okay? We are almost done. Are you in any pain right now? Would you like for me to cover you? I do have an extra blanket if you're cold. That did not happen. Now with tape, I would tape around. Okay. Yep. Almost done. Am I hurting you at all, Mrs. Ellie? Very good. My last tape. Then I would place this, sorry, I would date it, my initials, when I changed the dressing, and then I would place this here. And now I would throw all of this away. Okay. I would place my patient, I would put her bed at a low level, make sure her bed rails are up. I would place the call light near her so she can call me. I would then go and then I would remove my gloves, perform hand hygiene. I would then go and document how I found my patient, what dressing I did, where I did it, what I assessed as far as the length, the width, the depth, the way it looks, if there was any smell. I would time my documentation. I would put my name down, and I would know if I had given any medication or any of that sort. Thank you, Mrs. Ellie, and we will come back to check up on you.